actually, I guess through Julie, I went to one of Julie Jones's meetings, and Colleen and Julie wrote a book together. And so Colleen invited me to this meeting. So here I am.
Awesome, Sarah. We're so glad you're here. I'm here in Phoenix too, girl. So we got to get you added to our happy hour list so you can come out with us once a month. We just meet in Scottsdale, have food and drink and hang out. So, and then we have like 28 ladies on the list, but usually the ones that show up, it's like the core 10 or 12, you know, and they rotate in or out. So yeah, you should come and have fun. I'll add you to that. Jana, is it Jana?
Yes, it is.
Yes, introduce yourself and tell us where you're coming from.
Okay, my name's Jana Shea. I'm coming from Houston, Texas. And I learned about this actually from the Emerging Entrepreneur interview that you did, Colleen, which aired today.
Wonderful. Yeah,
so,
great.
And I was interested to hear what y'all ladies are doing.
Oh, awesome. Thank you so much for being here. Once we get everyone introduced, there'll be some more ladies jumping in here, but I like to at least take the first few minutes to find out where everybody's from and have them introduce themselves. So Vicki, why don't you go next? Vicki was our host last week. Was it last week? Was our host last week, did a phenomenal job. So just so that you guys understand, this platform that I've created here is how our members show up in the spotlight. This is one of the benefits of becoming a member of the LEAP community that I run, and you get to come teach this masterclass. So we arrange it, we organize it, we, you know, do the registrations and advertise it, and then you show up and do the teaching. And Dr. Melissa Balizan is one of our members of the LEAP community, and so that's why she's here today to teach. And same with Vicki Griffiths. So Vicki, introduce yourself, please.
Thank you. And thank you for the opportunity last week. I would recommend anyone that become a member so that you can do something like this. And she makes it so easy. It's really so easy. Really, you do just show up. You give your topic and you show up. That's it. Of course, you have to give your topic too. But I'm Vicki Griffith. I'm near Orlando, Florida. So the home of Mickey Mouse.
Awesome. Mary Scott, you want to introduce yourself and just say what you do and who you are, and then we'll have Dawn, and then we'll get rolling here pretty soon. No, you're on mute still. Come on, Mary, you know the drill.
I'm back. Sorry. I'm Mary Scott. I'm originally a videographer from New York, and now I'm living in St. Louis, and I provide business concierge services. I especially like to talk to startup businesses.
All right. Thank you, girl. And Miss Dawn Cermak.
Happy Thursday. I'm Dawn Cermak, and I'm with Hey Taxi, where mindset and community meet strategy and results. So we are focused on supporting female entrepreneurs on their journey, on all the different facets. We have a great community. We do a lot of networking. We also do a lot of strategy support as far as, you know, business plans and all that yucky stuff that's actually really important for your business. So we try to make it fun. We try to bring some good energy to the whole process. Taxes and Tequila is our signature course to deal with that unfun topic. And that's what we do. I just popped in to say hi. I actually have a client call at 4:15. So I just wanted to pop in and say, good luck, Melissa. I know you're going to rock it out of the park.
Thank you, Dawn. And the LEAP community also partners with Hey Taxi. So if anyone is in the Hey Taxi community at the level of the group coaching, they get to be a member of the LEAP community for free. So we give you that opportunity as an added bonus. So we work together, our two communities, because they focus so much on business building, and the LEAP community that I run focuses on exposure for you and your brand to be seen, heard, and be visible. And of course, I'm actually one of her authorized coaches as well in Hey Taxi, since I've been a business coach for 22 years. So Dawn, thank you for stopping in. Merelda, why don't you introduce yourself real quick and then we'll get rolling. There she is.
Hey, everyone. I was trying to make a cup of tea.
It's okay. It's okay. I just wanted to give you the floor real quick.
Hey, everyone. I'm Merelda Rodriguez, grief massage therapist and functional medicine certified health coach. So excited to see Melissa present because I've been wanting to connect with her. And so now I get to listen to her.
Sweet. And Merelda is also in the LEAP community. And you guys, this is a day early because this promotion starts tomorrow, but I dropped it in the chat that since I'm turning 50 next Thursday, and Sarah, we're having a birthday party for me because I just decided to throw one because I've never thrown myself a birthday party ever in 50 years. We're going to pitch in Scottsdale on Thomas, and a whole bunch of people are just going to show up, and we're just going to have drink and food and whatever. So if you want to come, girl, you just tell me in the chat. I'll invite you and send you the info, and then you can show up. So I would love to have you there since you're in Phoenix. And so this code birthday will work for you to be able to get $50 off. You know, that's my gift to you, or a free month if you want to join there. So it's up to you guys, but it's there for you. So this is a great organization for women that want to network and get more exposure for themselves. So Dr. Melissa Balizan, let's go ahead and get you up here on stage. So let me tell you a little bit about Dr. Melissa Balizan. So her and I have been working together for quite some time. She's been a member of our community for quite some time as well. She's my go-to pharmacist. That's why she's a doctor. She's been a pharmacist for I don't know, 20 some years, like 50,000 clinical hours. She'll get into that as she introduces herself. But I just wanted to share with you that I've called on her when I've been very sick to help me through some things. So, you know how you always want to have certain people in your pocket that you trust, that are go-to? Dr. Melissa Balizan is one of those people for me. I trust her with the decisions, what she tells me to take or not take. And she does something very different that we don't realize is happening in culture and society today. Doctors have this much training in medicine, and pharmacists, the only thing they do is train in medicine. So they have all the knowledge in the meds that the doctors are prescribing, because doctors prescribe to treat symptoms, but Melissa and all the other pharmacists that she works with, they help you get to the root cause so you can get rid of whatever it is and not just keep taking pills, right, to treat the symptoms. Because then what happens is doctors prescribe more pills, then more pills, then more pills. And before you know it, you're taking this pill to counteract that pill. It's counteracting that pill. So I was even doing that with supplements, right? I was taking handfuls of supplements every day, not knowing why I was taking them, but someone told me omega-3s were good. So I just started taking omega-3s, right? It was until I learned where my body was, what my body needed based on what I was eating and what I needed to take. So I work very closely with Dr. Melissa Balizan. I hope that, you really grasp the scope of what she's teaching us today, because she is absolutely phenomenal. So I'm just going to hand the floor off to you, and I'm just going to, shut up now. Oh, and ladies, we're live in our Facebook group only. I'm not live on just like a live Facebook page. I would never do that to anybody. This is a private Facebook group for our LEAP community. So I'll drop a little link in there if you guys want to join. You can put advertisements in there. You can celebrate in there, whatever accomplishments you have, we love for you to engage. So just so that you know where we're going live right now. Okay, it's all yours, girlfriend.
All right. Thanks, Colleen. Hi, ladies. I'm so excited to be with you here this afternoon and teach you a little bit about medications and supplements, the facts. What you don't know may be killing you. So that is true. I do have over 26 years of experience in healthcare, both in Eastern and Western medication. I have had the great honor of being able to be educated on supplements while I went to pharmacy school, and then I took it upon myself to do more education as the years progressed, more heavily in supplementation and continuing up with my medications. And also, doctors, fun fact, I have physician friends and know the school's curriculum. They get about 600 hours of medication training. And I, as the pharmacist, have well over 52,000 clinical hours. And schooling wise, I had 6 solid years of school, not just one semester like the physicians get. And so they're allowed to prescribe. I'm allowed to recommend and help keep their patients in sync. Physicians and pharmacists work well together and helping to make sure that you are on the right medication. Now, if you don't have a pharmacist working with your physician, they may be just compiling and piling and piling on medication after medication. So I want to let you know that more than half of the US adult population actually takes supplements, and 66% of the US adult populations actually take medications. Now, let me give you a couple of numbers. Over 4.5 million prescriptions are filled in the United States every year. Now, that does not count the over-the-counter medications that we take, the supplements that we take. There's things that aren't counted. These are things that are counted. And even with that, most of those numbers, most, not all, but they come from your PBM, which is your pharmacy benefits manager. So anything that goes through your insurance, if you pay cash for a prescription, which a lot of us do, then that may not be counted. So that number could actually be higher. So I want to ask you, who here is actually taking a supplement or knows somebody who's taking a supplement or a prescription medication or over-the-counter medication? Okay, so I see everybody's hand go up. All right, don't be shy. It's not gonna, I will call on you, but it's not gonna be harmful. Okay, so don't. So let's start with Colleen, because I know you were a little hesitant. I know you and I have talked about this, but I'm like, she's like one of the last ones for her hand to go up. Colleen, why do you take, so omegas, somebody told you to take omega. Why do you take that?
Oh, I'm glad that you asked. So I was just taking it because everyone said like, oh, it slims down your midline. I started taking them like when I was 30 or something, right? So now I'm turning 50. And they say, you know, you can get it through fish, but if you're not eating enough fish. So I would use it as a supplement for me not eating as much fish, you know, every day until I actually got blood tests taken and realized that I didn't need the level of omegas I was taking. I was actually kind of overdosing on it. My levels were too high. So we don't know what we're taking inside of our bodies or what it's doing to us. So after I did those blood tests, which I love because you just do them at home, right? Because you just mail in, you take care of it. Then I knew what level of how often I need to take and what level of those I needed to take that my body needed. I was just guessing. Yeah.
Exactly. Well, and I'm glad that you brought up the labs, because that is key. You know, I, as a pharmacist and your physician, usually like to have lab work. And often I hear all the time, so-and-so told me to take the omega, so-and-so told me to try this, so-and-so, you know, your girlfriend tells you to try a new shampoo, you're going to try the new shampoo. She tells you to try the supplement, you're going to try the supplement, right? Because, well, it's good for her. But when it comes to supplementation specifically and medications, it may not be the right choice for you. And we do need to do some lab work. And there are labs, yes, that I order that they come right to your home. And you do usually a little like a finger stick, like you do for the old style diabetic testing. Now the new style is they just have it on their arm, and but you do just a little pinprick. And there's a little bit of blood that goes in. Now, some tests we do need to use more, and so we do get a phlebotomist to your house. But having those tests actually does tell you what the right amount is, because supplementation, you can overdose on that. You can overdose on medications. So over-the-counter medications are medications that have been put on the shelf. The FDA has deemed that you don't have to have a prescription for them. Now, that doesn't necessarily make them any safer. Okay, so you can pick up your bottle of omega-3, or you can pick up your bottle of Prilosec, or you can get a prescription for omega-3, or you can get a prescription for Prilosec. So all of those, that covers both sides in those particular examples. And what that is that when the FDA comes up with a medication, one of the companies comes up with the medications, it goes through the FDA, and that's the Food and Drug Administration. Now, the FDA has a process in place that requires prescription medications and over-the-counter medications, because most over-the-counters were prescriptions first, to go through a process that they have to prove that they are safe, that they are effective, and they have to go through a process that shows what kind of side effects happened. Now, that's the case for medications. Supplementation does not go through that process at all. Okay. I could decide today, I'm going to start a supplement company. I could go to my backyard and I could scrape up some grass and I could send it to the warehouse and I can compound it. I could put it in a pill and I could sell it just like that. That's what happens. And if you're not getting good quality supplementation, you could just be taking dandelions from the backyard. You could be taking grass. You don't know what you're getting. So the difference between supplementation and medications, there's that safety component. Now, it's not that you can't get safe supplementation, but you've got to know what quality of that supplement you're getting. So you've got to make sure that you check in, make sure you're getting from a reputable source. Does that company do their own sourcing? Do they do their own testing, or is it sent out? Do they do third-party testing, which means an unbiased person comes in and tests to see what's in that bottle? That's what the FDA requires of medications. It can't be the same person. So when you're checking something, you want an unbiased opinion to tell you whether or not it's good or bad. So supplementation is definitely necessary, and it is a supplement because we're not getting, the foods are not providing for us the nutritional value that they used to. And sometimes we're deficient in things. So just keep in mind that supplementation needs to be good quality supplementation. When you're taking over-the-counter medications, you need to probably follow the recommendations of what's on the bottle, just like following the recommendations of the supplements on the bottle. You can have problems if you don't do that. So who here has seasonal allergies? Anybody? Okay, Vicki, do you mind if I call on you? So Vicki, for your seasonal allergies, what do you usually use?
So I take an over-the-counter allergy medicine and switch it out every time the bottle's empty. I switch it to a different brand according to my doctor. And unfortunately, right now I am taking, the decongestant.
Okay. So you're taking a decongestant. So decongestant has some things that can help with your allergies. And I love that you said that you switch it up. So let's talk a little bit about that, because yes, you can go and you can pick up an over-the-counter allergy medication. There's about 6 of them out there you can pick up over the counter. But what happens is over time that your body can develop a tolerance. Okay. And then that medication is not going to work as well. That happens with supplements. That happens with medications as well, prescription and over the counter. So when you switching those out, so if you're switching between Zyrtec and Allegra, let's just say, you take Zyrtec for a while, and if you were to continue to take Zyrtec year in and year in and year in and year in, it might not work as well. Okay. Now, my rule of thumb, you're going through the bottle. If it's just seasonal allergies, that's probably good. If you have year-round allergies, there could be something where you may have to switch every 6 months to a different, between the two. Between Zyrtec and Allegra, between Zyrtec and Claritin. Now there's different variations. There's Benadryl, which is the old standard of helping with allergies. Well, Benadryl makes you sleepy. And so then they came up with these class, the second generation of antihistamines, which can still help with things like we would use Benadryl for. We would use Benadryl for itching and contact dermatitis. We can use Benadryl for rashes. We can use Benadryl for allergies. Now, Zyrtec can be used for those same things. It's just not going to cause the sedation. You can't take it as often because it's formulated differently. There's actually supplementation that can help with those things as well. So as we go through this, there's a medication that's come out. One time it was probably prescription. Now they're over the counter. All of those medications for allergies at one point were prescriptions. There's some that have come out that we've pulled off the market because they were no longer considered to be safe. So initially they came out, they were safe. And then after long-term usage, there was more things that came out that said, oh, well, now this is being caused. So they did studies, but then when more people utilized the medication, more things were reported, and sometimes things had to be pulled off the market. Supplementation wise, that doesn't happen very often. Sometimes we'll get the supplement to be pulled off the market, and that's in rare cases because they're not regulated. But if in the extreme, if somebody knows that that supplement caused them to have severe liver damage or severe kidney problems or something, and they were able to pile it up the chain and get it, then the FDA can make that supplement company come off the market. That's rare though, because they don't have the control like they do with the medications. So let's talk a little bit about side effects, okay? Because a side effect is something that can happen with both medications, prescription, over-the-counter, and supplementation. And a lot of people don't realize that side effects can actually happen with, I'll get to questions in just a minute, Mary, that side effects can happen with supplementation, and that's true. So what is a side effect? A side effect is really an adverse event or an adverse drug reaction, and it's an unexpected, unintended, or undesired result that happens when you take a medication or a supplement. So if you take something and your stomach gets upset, that's an undesired result. That's an adverse drug reaction, okay? Or an adverse supplement reaction. I say drug because everything that you're taking is a drug of some sort. And if you didn't realize, most prescription medications started out from a plant source, a lot of it. And then some of them are still plant sourced. Some of them have been modified and changed. But when you're thinking that it's natural, comes from a plant, your prescription medications, a lot of them started that way. The digitalis plant, we discovered that it helped your heart, and now digoxin was born. Okay, so there's different things that happen along the process. Now, when we talk about these undesired events, some of them are very mild: upset stomach, headache, nausea, diarrhea, not pleasant, dizziness. They can get more severe, trouble breathing. You can pass out. It can cause another condition to happen. So what happens with that is that, like, who here takes or has taken or knows somebody who takes a non-steroidal anti-inflammatory, an over-the-counter, Advil, Aleve, naproxen, ibuprofen? Okay, Sarah, let me ask you, what was the reason that you decided to take that non-steroidal?
Did you say my name, Sarah?
Yes.
Pain.
Pain. Okay, that's good. That's very good. Pain, that's right. And what made you reach for whatever bottle of pain relief? What made you reach for that non-steroidal?
A recommendation of a doctor.
Okay. And that's good. So they recommended that you get something. They didn't feel it was severe enough for you to have a prescription, but they thought you needed to have a medication. So a non-steroidal anti-inflammatory agent that you reach for pain, because if you're in inflammation, you're in pain. And I talked a lot about that on my TV show. So I'll put the link in for that later. But when you reach for something like a non-steroidal, are you aware that there's side effects that can happen with that, and things that you can actually, non-steroidal anti-inflammatory agents can actually lead to high blood pressure? Were you aware of that? Okay. So what can happen now, not usually one-time use. Okay. It usually is longer use, but what can happen with those non-steroidals, that's one example. Medications can cause an adverse event. Now we think of adverse events as those easy ones: headache, not feeling good, dizziness, but it can actually cause high blood pressure. Okay. There's other medications that can cause high blood pressure. There's supplementation that can cause other diseases as well. So you've got to be careful when you take something, and if you're taking something for the pain, and the pain all of a sudden, okay, so your pain goes away, but now you get dizzy. Okay, let's just say now you get dizzy. So you talk to your healthcare professional and they say, oh, okay, well, now you need to take this. And this happens all the time. So now you're taking two things. You're taking something for your pain and you're taking something for your dizziness. When, if we had to stop to think about it and go back, we would have got to the root cause of the problem. We would have figured out that the dizziness came because of the pain relieving medication. And we could go and change that pain relieving medication to something that maybe doesn't make you dizzy. Okay. So let me go back here. I know I saw a couple of questions come through. Let's see. Mary had a question. Sorry, I gotta find it.
Just have
about-
Mary unmute herself and say it.
Yes, Mary.
It was about the supplements that people take very often are vitamins. And the water soluble ones will flow right through you. But if you take too much of the oil soluble ones, you can get into trouble.
Well, and that's half true. The water soluble supplements are not without problems. So
Okay.
you can still have issues with water soluble supplements. Yes. So when you're taking supplementation, thank you for bringing that up, Mary. So when you're taking supplementation, vitamins, especially, they're considered fat soluble or water soluble. So fat soluble needs to have the fat to dissolve them. Okay. Water soluble vitamins typically will be dissolved with the water that you drink that supplement down with, as long as you're drinking enough water. So many people will just pop the supplement or pop the pill, and they're like 2 ounces of water. You really need to follow it with 8 ounces of water to get those pills down, to get them down into your stomach where they need to go. They go through a first pass effect, and then they can get into your system appropriately. But what happens is even water soluble pills can have side effects. Okay. You can, your stomach may not break them down appropriately. Okay. So they don't necessarily need to have the fat, but your stomach, there may be another underlying issue that your stomach, you may not be able to digest them appropriately. So you've got to pay attention to that. You can overdose on water soluble vitamins. You can overdose on fat soluble. You can overdose on medications and over the counter and both prescription medications. Now, when we talk about overdose, so let's talk just a little bit about that. Ideally, that's something that we hear of. We hear of, oh, they had a narcotic overdose. They had an opiate overdose. And there's usually an event where they lose consciousness, they have trouble breathing, or they stop breathing. But you can overdose on other things, supplements. You can take too much of a supplement. It may not cause the trouble breathing, but it can cause digestive issues. It could cause you, maybe it causes you to be dizzy. Maybe it causes you to not concentrate as well. There's different things. Each one has their own problems. Okay. And certain medications, when you take too much of them, sometimes they just make you sick. Sometimes they can stop your heart. They can stop your breathing. So it's very important to go with the recommended prescribed dose of whether it's over the counter, prescription, or supplement. And you want to make sure, so some supplements say that you need to take 4 tablets for a serving. Well, 4 tablets of one supplement, that's a lot. So I would really want to pay attention to what's in that bottle. And sometimes maybe you need all 4, but you probably don't need to take all 4 at once, because they split it up into 4 pills for a reason, because they weren't able to cram all of the nutrients into that one pill. They had to put it in 4, and usually you need to split those pills up, okay, and not be taking them all at one time. Is there a question in there? Okay. All right. How are we feeling, ladies? Are you getting a little information? Are you overwhelmed? Okay. Okay. So let's talk about multivitamins. Who here has heard you should take a daily multivitamin? Okay. Who here takes a daily multivitamin? Okay. Merelda, let's talk to you. Why do you take a daily multivitamin?
I take it because I sometimes don't feel like I'm eating right and getting everything from my food.
Okay.
And I also think that on days that I'm stressed out, I'm probably using more nutrients that I'm replenishing. And so that kind of helps me stay, or at least I think it helps me stay.
Okay. That's good. Thank you.
But
Thank
that's
you.
mostly, yeah, it's mostly because I don't feel either that I'm solidly getting what I need to be in sufficiency,
Okay.
or if I'm utilizing more than I can replenish. Yeah.
Sure. Okay. So let's talk a little bit about multivitamins. So a multivitamin is a tablet, capsule, pill, gummy that has a variety of nutrients in it. Okay. Now a multivitamin usually has both vitamins and minerals, most of them. Some have iron, some don't have iron. But what happens with that is they put a little bit of everything. So you're usually not getting the recommended allotment of that. And it is a supplement, so if you're not getting enough vitamin B12, then maybe a multivitamin might have just enough, the 400 micrograms in there that you need. But ideally, I would recommend you get some lab work done and find out, okay, is it truly that entire spectrum that you need with that multivitamin? Or do you just need B12, thiamine, calcium? Okay. And yes, that is 3 pills versus 1, but
the levels are different.
The levels
are different. That happened to me. I don't take one anymore, Merelda. So I take like a special D liquid, and then I take a B something else because I didn't need all that other stuff. I was actually overdosing on vitamins too, and you just spill it all out. So it's like wasting it. Anyway, go ahead, Melissa. Sorry. I get so passionate about this stuff. Like, girls, we have to know what's going on in our bodies. We have to know.
Exactly. And that is one of the key things. And why I'm calling on you is because, and I asked the question, why are you taking it? I talked to so many different people and I asked that question. Okay, so let's go through your meds. Okay, you got this multivitamin. Why do you take it? Why do you take omega? Why do you take Prilosec? Why? Let me tell you that about 80% of the people don't know. And that's sad to me because somebody told them to take it for some odd reason. They may have told them a reason, and they may just said, oh, well, my doctor recommended it. Ask the question. When your doctor recommends something for you, ask, why? Why do you want me to take this? They say, okay, because I take it. Why? Why are you taking it? What is it doing for you? That is very key. You want to know what you're putting into your body, and is it the most appropriate thing for you? Okay, so just keep that in mind. Because when we talk about, especially vitamins, they can actually, there's certain vitamins that can slow down your metabolism. There's certain ones that can speed up your metabolism. So when you slow down your metabolism, you have the higher potential to gain weight. Okay, even if you're still moving and doing things, you can gain weight because your metabolism is slowed down, because the vitamins that you're taking, maybe an overdose, maybe an under, may not be appropriate. So just keep that in mind when you are trying to do the convenience of one pill fits all. So like I have this, I would love to just put everything I take in one pill. So I have to take it one time. It's the big pill though. Because it is more convenient. Our society, we want things to be convenient. but convenient may not be appropriate for you. So just keep that in mind. You may need to get the right amount of calcium. You know, the calcium that's in a multivitamin rarely, now this is rarely because I don't know everyone out there, rarely goes over 300 milligrams. Most of the time, you're going to need, I think everybody in this room is going to need about 1,200 milligrams of calcium as a supplement, unless you're getting enough calcium with the foods that you eat. Okay. And milk is not the highest calcium. Vegetables have a higher calcium level. So keep that in mind. Now I want to talk a little bit about, I have my notes here. Let's see. Let's talk about adherence. Okay. So when you start taking that multivitamin, I'm going to pick on you a little bit, Merelda. How often do you take that multivitamin?
Daily.
Daily. Okay, that's good. All right. Colleen, how often do you take your calcium? I don't know. Do you take calcium?
I
Or your
take
vitamin
zinc.
D? You said
Oh, my
vitamin D.
vitamin D, I do 5 drops under my tongue every morning.
Okay.
Mhm.
Every morning, consistently, no problem.
That's correct. And that was based on my, I have like this like whole like, thing that I do every morning. So everything goes in order. So I
Okay.
don't forget. And that's because my D levels were so low. And this has been, the 5 drops is how much I needed from this liquid.
Okay.
Yeah.
So, okay. So you ladies are doing great. You're taking it every single day. But how many, or in the past, you just take it when you feel like you need it? Maybe you're not taking it.
That's how I
every
do
day.
vitamin C.
Okay.
Is that bad? Like, how many of you do the same thing? You only take vitamin C when you're like, oh, I'm starting to feel a scratchy throat. Oh, I feel a little, it's that time of year, right? That's me on vitamin C. So I'll just be straight up honest.
Okay.
Yeah.
So that's good. And things like that. And like Sarah, her pain reliever, those are things that as needed, and that's appropriate for as needed. But so many times I hear, oh, well, I take it when I think about it. It's just a supplement. What does it matter? What if it matters if I miss a dose? Well, it does matter, because whether you're talking supplementation or you're talking medication, and we talked a little bit earlier about with Vicki and the tolerance, what happens is that over time, your body gets levels, and that's why blood tests are great. We can check those levels. And if you're not taking a supplement daily, and if it's recommended daily, and you're not taking it daily, you may have deficient levels. Okay. So that's something to keep in mind, is to know that you need to take that supplement for the duration that it's recommended. Now, also, just like allergy medications, supplements, you can develop a tolerance to it. So your multivitamin that you're taking, if it's appropriate for you to have all of those things, you just need a little bit of everything. Well, that brand that you're taking could wear off. And all of a sudden, you've been taking the same multivitamin for 2 years. And now all of a sudden you're starting to feel more sluggish. Well, it could be the vitamin. It could be hormones. It could be different things, because as we age, things change. And our hormones affect us, both female hormones and overall hormones. We have more than just female hormones that change the way that we react to things that we put in our body. So when we're putting pills in our body, or oils, or whatever it is that we're utilizing, our chemistry may change, and it could change the way that it's absorbed. It can change the way that it actually binds to the receptors to make whatever it is that we're wanting to work. So when that pain medication, Sarah, isn't working like we thought it was, it could be that something else has changed as well. So we have to keep that in mind and realize that, okay, do we need to change the medication? Do we need to look and see, okay, what else has changed for us? As we age, our hormones change. As we're stressed, our hormones change. How we're able to metabolize things changes if we're in a stressful situation. So all of this plays a role in how we respond to the medications, to the supplements, to whatever it is we're taking. So adherence is key, tolerance, knowing why you're taking something. If you happen to have been prescribed an antibiotic, so rare case you have to be on an antibiotic, there's things that go in with that. So who here takes a probiotic? Okay, a couple people. Okay, so Vicky, your probiotic, if you're prescribed an antibiotic, do you know what to do with that probiotic?
Other than keep taking it, no.
Okay, so yes and no. How's that for an answer? My dad always
Ooh.
used to say, well, yes and no. I'm like, okay, I want an answer. So here's the, yes, you still need to take it, but you have to separate it from the timing of your medication. And certain antibiotics are different. So usually a 2 to 3 hour window is a good separation, because what happens is the antibiotic is pulling out the bad, ugly bacteria, and the probiotic is putting in the good bacteria. But if you take those at the same time, they actually counteract each other, and that's not good. Now the antibiotic is pulling out that bad bacteria, and we do want to replace with good probiotic bacteria, good bacteria. So anybody, even if you're not taking a probiotic, when you start an antibiotic, it's a high recommendation that you go on a probiotic, or you get some good bacteria in your system. So yogurt is very good with lactobacillus. It's got a good bacteria in it. Now, of course, you can't eat it with the antibiotic. You have to space it apart a couple hours. But if you're getting an antibiotic, I'm going to recommend you a probiotic. Take it a couple hours apart, and take that probiotic a couple of days later after the antibiotic is finished. That will help get the good bacteria back into your system as the bad is being pulled out. And it helps reduce your risk of yeast infections, which is very high with antibiotics. So that's that. So what I would like to do now, since we've got about 15 minutes left, is I want to kind of just open up the floor. I'm going to put a couple links here in the chat. I want to let you know that you can learn more about me. You can go to my website. I also have a weekly TV show that is on the, I have a link for, it's on the WIN network, and it's also broadcast on Roku every week. So you can find it there as well. And I have a gift for you. So 5 questions to ask before starting a pill, medication, or supplement. And so I'm going to put the link in the chat for that. So if you want to grab that and go through more than just what we talked about, but there's a couple more things that is important to understand why you're taking something. That's number one. I would ask why you're taking it. Why are you recommending this to me? When you go in for that prescription, why? Okay, you went in for a reason. Do you have a cold? Do you have the flu? Are you newly diagnosed with something? What's the reason? So I'll throw those links in the chat. And then who has a specific question or wants to know something else specific, and I'll answer questions. Okay, let's go with Mary first.
Oh, I had Vicky up.
Oh,
I
sorry.
changed it. Can we go with Vicky and then Mary?
Yes,
Okay,
we
I
can.
had Vicky up. Okay.
Yes, I had to go look at my links, so my apologies. Vicky.
That's okay.
Actually, I have several. So you keep
Okay.
talking about getting your labs done. So other than having my labs, I have them done once a year from the physician. The insurance company pays it. I'm familiar with Everlywell, but what's a good, lab that we can work with on a private sector that's reliable?
Yes, that's a great question. So I have a couple of labs companies that I order from. Now, one of them, and I do get credit if you order it through me. So I use Equilife and I use Rupa Labs for my two most, and then I also use Ulta. Now, with those, I can help you order the test. Some of those come to your house. Some of those are phlebotomist comes to your house. Some of them, so Rupa, some of the insurance will pay for that through Rupa. Some of it won't. I believe Equilife is all cash paced. When you're getting your traditional labs done through your insurance, your physician is most likely ordering the basics: CBC, CMP, lipids. If you're having complaints, they might do a thyroid panel. If you're having fluctuations in hormones, they might order that, but it's rare. So they're going to do the basics. Now, the basics are great because we need to know those. We need to know the staples. But usually with these other companies, we go and we do a deep dive. I just did one the other day. We did an inflammatory level. We did intensive vitamin D level. You have to ask specifically for that. We did a vitamin C. We did a B level. All of these things were separate tests, all one stick. Okay. So they only had to be stuck one time, but we were able to do like 14 different tests. Okay. So that's hopefully helpful for you. And I also threw my link for scheduling, askdrmelissa.net. You can schedule a consult with me and we can talk about getting you labs ordered so that we can get you the most appropriate labs ordered for you. And then we can figure out which company is the best and where your insurance might help out. Or if you have an HSA, they might just reimburse you for those as well.
Awesome. I appreciate that.
Okay.
My next question is my doctor keeps wanting me to go on osteoporosis medication. And when I asked her why, she said, because my mother takes it. And then she handed me a booklet and there was things like the side effects are you have broken bones. I'm like, well, this doesn't make sense. Why would I take something that could break my bones?
Mhm.
So I'm on a supplement for bone growth, but then eventually it increases my DHEA.
Mhm.
So any recommendations for supplements for that?
So, okay. For bone growth specifically, I don't have one off the top of my head. Calcium and vitamin D are staples, but we wanted to see where your levels are at. And I would encourage you to book a consult with me because you may be allergic to something that's in my head that I might just say, and I don't want to. I want to tailor it to you, something that you're not allergic to, something that's not going to, things we didn't touch on earlier, interact with whatever else you're taking. So that is very key. Supplements interact with other supplements and supplements interact with medications and vice versa. So I highly recommend you book a call with me, Vicki, and we can sit down and talk about that. And we can go through the specifics for you and get you the right lab work, get you the right supplement for you, get you a good quality supplement because I have those in my pocket as well. That we can make sure that you're getting the good quality supplementation that is necessary for you.
Awesome. Thank you.
Quality matters, Vicki.
Yeah, it
Quality
does.
matters. Yeah, totally. Those are good questions. I know Dr. Melissa can help you. You're in good hands.
Awesome. Thank you.
You're up, Mary.
Okay, I was having a lot of trouble with brittle and cracked fingernails. And I was told that biotin would be a really good supplement to take for that. So I started doing that. And my doctor said that, yes, biotin is the supplement for hair and nails. But if you're taking 500 or more micrograms, and something happens with your heart, like they end up doing a heart test or some kind of lab test, you need to tell whoever's doing the lab test that you're on biotin because it can screw with the results. I would like an explanation.
Do you know what kind of test?
They just said something to do with heart, like heart palpitations, or, you know, if they're doing some kind of heart test, lab test, and you're on biotin. The other thing is like, and this made me think of like my late husband was throwing CPKs, and it had to do with a pain situation rather than that he was having a heart attack.
So what I know about biotin, it is, yes, it is good for hair, skin, and nails. It definitely has been. There's been studies out there that show that it helps with the growth. Good quality, of course. You want to make sure that you're not just getting off the shelf. I could do some more deep dive, but what I know about that is it can block some of the results, especially when they're checking your levels, like for heart attacks. So it can falsely lower those blood test results. And I believe it has to do with the CRP. I'm not 100% sure, but I believe that's where it is, has to do with, because of it's just the way that the biotin is, the affinity in your system, the way that it acts on your receptors, that it can falsely change the markers when you're looking, especially for a heart attack. So if somebody has symptoms of a heart attack, that's where it's blocked. I'm not sure about routine test. I would have to look more into that. Okay.
That's good. Thank you.
And
Did anyone else want to pop up here? Oh,
Sarah?
yeah. Sarah wants to come up. Come on up, Sarah.
Hi.
Putting you on camera, girlfriend.
All right.
You're
Hello.
so pretty. My gosh, girl.
Thank you. Thank you. Well, first I want to say thank you so much for sharing all of that information you shared. A lot of it was above my head, but I was listening. And my specific question is about brands of supplements. Like I take all the vitamins. I recently got blood tests done, and there were some areas I was low in. So then my doctor recommended to get, more iron, more vitamin D. And there was no brand she recommended. So I used just basic like Nature's Gate or something from the store. And I know I'm awful. So I need to know a brand that I should be ordering from if you have that.
yes, and I have several brands that I order from, and I actually have I have a way to send you that so that I get a little credit for that as well. So I would recommend you book a little session with me and we can get you the right brand. But I use full scripts and we can get you to the right. There's several brands in there that I like. Designs for Health is a good one. Life Extension's a good one. But if you go to Full Scripts, or if you go to my website and you go to my picks page, there's a link that will direct you directly to Full Scripts, and you can set up your Full Scripts account. And that way we can get you set up in there, and we can get you the right brands and the good quality brands. And we can specifically put in what she wants for you to take. So easiest, book a consult with me at AskDrMelissa.net, 20-minute consult. And we can do that, and you can get that off my website. You can book a consult directly from there, or you can go to the link. But that way I can get you specific links to the supplement company. And when I use supplements, there's several brands in there. I do try and get you to pretty much one company, because I think that that's good to have some continuity.
Mm-hmm. Thank you.
Okay. All right. Jana, did you have a question? Okay.
Okay.
right.
Awesome. I'm going to remove your pin here. Oh, wait, Mary's got another one.
Yeah, I mean, I understand sometimes it's hard to say what brands are good. I was wondering, other than the store brands at the grocery store, are there common supplement brands that we should really kind of avoid or take with a grain of salt or something? I'm thinking, some of the General Nutrition Center stuff, or, Puritan's Pride is a big brand of online accessible.
So that's really hard for me to say, Mary, without going and doing research. to tell you what to avoid. There's hundreds and hundreds of companies out there. If you do the research on them, there's some big companies that are good companies. They're good quality, but there's also, so I can't really tell you what to specifically avoid. Like I said, Designs for Health, that's a company I use a lot. I have a link for that. And then they're in Full Scripts, and I use Life Extension a lot. Those are my two pure encapsulations, probably my top 3 things, because they have a good variety of everything and they're reasonable, are good quality. But you're gonna have to go through somebody to order them. It's gonna take you that extra step to have a little chat, and then once we get you set up, you can set it up on auto ship. You can set it up to come to you every month, so that you don't have to have another conversation unless you want to with me. But we can get that set up for you and get you good quality brands coming in. But most of the things that you can pick up at your vitamin store or the grocery store or big box store, I would say avoid, because you're just
I agree
throwing
with
your
her.
money away.
Yeah, if it's like, $8 for a pill bottle, they're probably not going to be good, quality. So, but thanks for it. You guys can, if you want to change your view back to gallery, you'll be able to see everybody. That's up to you. I'm dropping the link. And Melissa, Dr. Melissa Balizan. Oh, that was so good today, right? She's awesome. I love having a pharmacist in my circle. I don't know, you guys. Then we have Merelda and we have Vicky. And I mean, all these women have so much goodness that they do. Each one of them are so spectacular. So Melissa, thank you so much. This was phenomenal. I wanted to drop the link again for you ladies. No masterclass on the first Thursday of the month. We never do a masterclass on the first Thursday of the month. We always do a networking event for 90 minutes. This is for you to network and get to meet other ladies. So picture kind of walking into a room and like going and hanging out, in little areas. That's what we do. So you come into the networking event. I break you up into rooms. You get to meet ladies and talk. That's what we do for 90 minutes. It's so much fun. But because it's my birthday that day, show up a few minutes early and we're going to have like a little dance party. But I do that anyway, normally, but we're still going to have a dance party because I love to dance. So there's the link. It's free. Go ahead and register. We hope to see you on April 7th. It starts at noon Pacific Standard Time. So we hope you can make that. It's just a way to network and meet some other ladies. No masterclass next week, but then the following week, we will have a masterclass. And that following week, I can't remember who's teaching because I didn't pull it up in time. Let me see if I can get it pulled up in time here. The following week on the masterclass would be on the 14th. And we don't have that one loaded yet for that masterclass, but we also have 3 other networking events going on throughout the month. So if you're on our meetup, you'll see that Leap for Ladies, there's a Phoenix division, a New Jersey and Philadelphia division, a Chicago, Illinois division, and those are going to be throughout the month. If you live in one of those states, you can attend those. If you don't, you can still attend those. So Merelda could attend the one in Chicago and attend the one in Arizona if she wanted, or New Jersey, because they're still doing them online. So if it's just a way to meet some different ladies, if you guys want to do that. So that gives you 4 networking opportunities for the month of April. So they're on Meetup. You guys can sign up for those. Thank you, Melissa, for being here with us today. Ladies, thank you for putting your time and energy into being here today and learning more and following up with Melissa. Her information, I kept dropping it in the chat. So we hope to see you guys soon again. All right, we'll see you later. Take care and have a wonderful week.
Bye.
Bye-bye.
Hi.